I'm Vic Senese, and welcome to UroNurse News. Today, we're diving into an important topic that affects many men with benign prostatic hyperplasia, or BPH, particularly those experiencing lower urinary tract system, or as we like to call it, LUTS, urgency, frequency, and nocturia. Treating LUTS in men can be challenging. Often the symptoms are linked to prostate enlargement, but there's another factor that's gaining attention in research: chronic prostate inflammation, or CPI. We give abbreviations to everything, folks. The big question researchers are asking is it the inflammation itself or simply the enlarged prostate that drives these troublesome urinary symptoms? To explore this, a recent study looked at 51 men undergoing transurethral resection of the prostate, or TURP, common surgical treatment for BPH, based on pathological examinations. Patients were divided into two groups, those with chronic prostate inflammation and those without. The researchers used several evaluation tools: the NIH Chronic Prostatitis Symptom Index, guess what, NIH CPSI, you figured that one out, the International Prostate Symptom Score, or the IPSS, and the Overactive Bladder Questionnaire, or the OAB, version 8. Pre- and post-operative comparisons. In addition, all patients underwent clinical exams including a urine culture, a PSA, uroflowmetry, post-void residual urine, and ultrasound of the prostate and bladder. So, what did the study find? Interestingly, there was no significant difference between the two groups on any of the clinical exams. Both groups showed significant improvements in CPSI and IPSS scores after TURP. However, here's the key takeaway: overactive bladder symptoms only improve significantly in patients without chronic prostate inflammation. For men with CPI, OAB symptoms prove more persistent and challenging to manage. So what does this mean for you men that are undergoing TURPs? Identifying concomitant chronic prostate inflammation in men with BPH could help guide postoperative care and decision making. In other words, while TURP is highly effective in reducing many of the lower urinary tract symptoms, men with underlying inflammation may continue to struggle with urgency and frequency and may benefit from additional treatment strategies. This study underscores the importance of a personalized approach to BPH management. By recognizing the role of chronic prostate inflammation, healthcare providers can better anticipate persistent symptoms and improve patient outcomes. Tomorrow on UroNurse at uronurse.com. Are you curious about the latest tools and how they can make your work and life easier? The latest AI tools, that is. I haven't done a talk on AI in a while, so I thought this would be a good time because, man, is it that changing so quickly. So tomorrow on UroNurse, I'm going to break down the newest AI innovations, showing you practical ways to boost your productivity and creativity. Trust me, a lot of what you see on the show is created using AI. Even that picture of me, that was AI generated. So join me as I explore which tools are worth your time and how to use them effectively. No tech expertise required, but you might have some fun. So for that, this is our last episode for this week. Be sure to join us next week for more of UroNurse News.
Oh, UroNurse News, let's learn and share on YouTube, LinkedIn, X, and Facebook, everywhere. 5 minutes of wisdom for patients and peers.